Washington recently passed a bill raising the age to smoke and use tobacco or vaping products to 21 years old. Our state is the 9th state in the nation to do so, and that new law will go into effect in 2020. Joining me now to talk about that and the upcoming World No Tobacco Day, which is next Friday, May 31st, is Dr. Ari Gilmore, a provider with Pacific Medical Centers. So first of all, will this new law impact smoking rates, especially among teens?
We really hope so. And the great thing about it is it's addressing a time frame when long-term smokers generally begin their habit. Over 90% of people who are adults who smoke regularly started before the age of 21. And additionally, it's really going to get to that new vaping that's going on and try and help reduce the access to that, because that's what people are trying and unwittingly getting hooked on before they really know the health implications.
Okay, and we'll talk about vaping in a moment, but first, when you talk about the damage that tobacco can cause, we know the cancer risk, but can tobacco damage be reversed over time if someone stops using it?
Yeah, and that's my favorite thing to tell patients when they come in to discuss stop smoking, is that many of the effects can be reversed, and quickly. Early on, within hours, the blood pressure goes down. Over the first day, the carbon monoxide in your blood goes down. Your body can carry more oxygen. And then over the next couple months, your lungs begin to heal, and the effects of hypertension and cardiovascular disease begin to fade away, such that at 10 years, people's risk is much less than someone who continued smoking. So there's lots of good reasons to stop at any time.
Yeah, so it's never too late to begin to quit. All right, let's talk about vaping and e-cigarettes. Is enough being done to curb this habit among people in general, but specifically among teens who are starting to use it?
I think the debate is really just starting, and it's everything we were worried about when we saw the products come online with the move towards flavored ones and so forth. But I think schools are really trying to address the small size and packaging that makes it easy for people to surreptitiously use, and we're starting to have that debate about how addictive nicotine is. The problem is it's so easy now to get the nicotine high. You don't have to smoke a whole dirty, gross cigarette, and kids think that it's healthier rather than less harmful. And so it's a real problem.
And that's not true, right? We don't know enough about these
Absolutely,
risks.
absolutely. For young people, it's definitely harmful, and kids need to know that once they start, the effects are so strong in their developing brains, they don't know when to stop, and sometimes they've had a habit for quite some time before it becomes evident, and it really is difficult for them to stop. There's stories of kids, going into the bathroom stalls in between classes, and that's just terrible.
World No Tobacco Day is really a call to action. It's May 31st. What can people do now to join in this effort to help stop smoking rates across the country?
Right. Well, I think first of all, for people who are smokers, really trying to quit, going in and speaking to your doctor. There's some really effective medications and other avenues that can help people who are smokers. When things come up like legislation for the Stop at 21, supporting your legislators, writing letters, letting them know we're behind this. The vast majority of adults agree that a 21 age limit is very reasonable. Making commitments with friends and family to try and help them quit. Some people respond really well to a little bet, put some money on the table. And then educating our youth about nicotine, and really talking about both smoking and vaping and how difficult it is to stop. And not only talking about the health effects, but when you phrase things for children as a way of being defiant, you talk about the money that big tobacco's making when they have a lifelong smoker, and how they're kind of being defiant and keeping them from making their money. Sometimes kids respond to that kind of sense of independence, and I'm not going to, do what the authorities want.
So take action, be part of the solution. Dr. Ari Gilmore, thank you for being here. We sure appreciate it.
Thank you.
And if you would like to learn more about World Tobacco Day next Friday, May 31st, you can jump on our website, q13fox.com/healthyliving.
Well, an immediate order to fix hundreds of culverts in our state. We're going to break down what the federal mandate means.